Here's the passage, the article that we're working on about peanut allergies. The first thing I'll do is just to go over some of the words that we talked about during the session. Asthma, realize, so keeping the S in at the end of realize. Children, a really strong R. Children. Allergic, allergic. Analyzed, carried out a study. So really linking and connecting that entire thing. Pediatric, respiratory, respiratory. Tested. All right, so after you've worked on some of those words and got them in your ear, we can get started with the passage. Peanut allergy warning to asthma sufferers. Study. Children with asthma may not realize they are allergic to peanuts because the symptoms are so similar, a study has suggested. Scientists who carried out a study in the United States said symptoms such as shortness of breath, wheezing, and coughing are seen in both conditions. They analyzed the records of more than 1,500 children from the pediatric. Okay, I'm going to try that again. I got confused because I had it written in phonetics. They analyzed the records of more than 1,500 children from the Pediatric Respiratory Clinic at Mercy Children's Hospital in Toledo, Ohio, and found 1 in 10 tested positive to peanut sensitivity. However, more than half of these children and their families were not aware and did not suspect that there was any sensitivity to peanuts. And you'll notice that the words that are in blue are the ones that I'm really putting emphasis on in the sentence. And the ones in red were the ones to really focus on the sound, the R and the S. Here's page 2. They found the prevalence of known peanut allergy was similar across age groups. Lead author Robert Cohn said, many of the respiratory symptoms of peanut allergy can mirror those of an asthma attack and vice versa. Examples of those symptoms include shortness of breath, wheezing, and coughing. This study demonstrates children with asthma might benefit from a test for peanut sensitivity, especially when control of wheezing and coughing is difficult to achieve. If a physician is having this problem, or if a parent notices it in his or her asthmatic child, they should consider testing, even if they believe their child is not sensitive to peanuts. Okay, I'm going to stop there, and let's look at a few more of the words in the passage. Let's look at the section that has a lot of S's. This is the second paragraph. So I'm going to do it really slowly, just focusing on the S's and the Z's, and then you can go ahead and try to really say it with the S and the Z, with your tongue behind your teeth. It would help if you videotape yourself so that you can watch it and know if they were said correctly. Scientists who carried out a study in the United States said symptoms such as shortness of breath, wheezing, and coughing are seen in both conditions. Now I'm going to look at the second paragraph on the second page where it says lead author. Let's look at a few of these words. Respiratory, symptoms, respiratory symptoms, mirror, so a really strong R with your tongue curling back, mirror, can mirror those, vice versa, vice versa. And now let's try that last sentence in the second paragraph, getting really strong S's and Z's with your tongue behind your teeth. Examples of those symptoms include shortness of breath, wheezing, and coughing. So I noticed that I linked together those symptoms and I linked shortness of breath and I linked wheezing and coughing. I'll do the whole sentence again. Examples of those symptoms include shortness of breath, wheezing, and coughing. So you can try to do that and videotape yourself and work on all those S's. Good luck.